Nothing will take a child further in life than a warm smile and a great disposition. That's why this February is National I Give Kids a Smile Month, which is aimed at providing free dental service to underserved children. And with us today from the Florida Department of Health is Dr. Stephen Ebner, Senior Dentist in Polk County. Dr. Ebner, thank you for joining us today.
Hi, Andy. Thanks for having me.
Now, tell me a little bit about National I Give Kids a Smile Month.
That's a program that's organized by the American Dental Association, and it goes through the local dental societies. So the Polk County Dental Association runs that. It's done with volunteers. The dentists volunteer their services, assistants volunteer their services, and it's usually done on a Saturday, usually a Saturday morning, sometimes Saturday afternoon. Children are seen, examined, urgent care is taken care of, and then arrangements are made for follow-up care after that first visit.
Now, why is this so important to children in Polk County?
Well, Polk County has a lower dentist to population ratio than the rest of the state, and so sometimes access to care is an issue. So this addresses that issue of access to care. It allows kids that normally wouldn't have access to care to at least get one visit and at least get one thing taken care of, and then arrangements can be made for them to see the appropriate resources to provide follow-up care.
Now, what is the importance of dentistry specifically to children?
Well, dental caries or cavities, that's the most common disease in children. So the problem with kids is it affects their quality of life. If they have a cavity, if they're in pain, they have trouble eating, trouble speaking, they're going to have trouble in school, they're going to miss school. So, and that's not to discount the possibility of pain and swelling, and possibly even a trip to the hospital emergency room.
Now, what is the typical service that is provided to a child once they come to a dentist appointment such as this?
The first visit, we like to see the child no later than age 1, and I know that seems young, and that's probably something that some people aren't used to. We say when the first tooth comes in, that's when they should come see the dentist. The first visit is very simple. The child usually sits in the parent's lap. We go over a few things, mostly with the parent, on how to keep the teeth clean, whatever teeth are there, visually check everything. Also gives the child a chance to get used to come to the dentist and be familiar with all the the sights and the sounds and the smells. Gets them used to coming to the dentist, and hopefully we can avoid problems and do some prevention before there are problems.
Now, what happens as the child grows older?
As the child grows older, usually about age 3, we're able to do some sort of a cleaning. That's when most of the baby teeth are in. And somewhere between age 4 and 5, usually we can start to take some x-rays to check for cavities in between the teeth. And then we go from there. Usually we're able to do a cleaning at age 3 and x-rays somewhere between 4 and 5.
Now, it's interesting because I have children that are right in that demographic, and I know that I keep on hearing that dental sealants are really important, but I really don't know what those are. Can you tell us a little bit about what a dental sealant is?
Sure. Dental sealants are usually a clear or sometimes a tooth-colored plastic coating that go over the grooves of the permanent molars. Now, the permanent molars come in somewhere around age 6. So we have a program that we go to the schools and we see second graders. So we're pretty sure that the first molars are there. So what's done is the tooth is cleansed or cleaned with a mild solution that etches the surface of the tooth and cleans off the plaque and the bacteria, and then the sealant is a clear, like I said, a tooth-colored plastic coating that's sort of brushed on, and then it's cured with a light. And so what that does is that fills up those little nooks and crannies that the toothbrush can't get, and that stuff can get wedged in and couldn't clean it out with a toothbrush. So that prevents cavities from occurring on those permanent first molars, which are teeth that have to last you the rest of your life. So they're pretty important teeth.
And what was the age that you said that those are usually applied?
The first molars come in between 6 and 6.5. So our program, we go to second graders, and that's usually age 7, and that's the initial visit for the sealants on the permanent first molars.
Now, are there services that children usually need that the health department doesn't provide, or?
The services that we don't provide are orthodontic treatment, that's braces. If the child needs what we call deep conscious sedation, that's something that a pediatric dentist would provide, and that's where they drink a little cocktail that kind of puts them to sleep a little bit. We don't offer that. We don't do any dentistry in the hospital. That's sort of the third step. If that conscious sedation doesn't work or they need very extensive treatment, then sometimes they'll go to the hospital and have that done all at one time. The other thing that we don't do, if there's an impacted tooth or a tooth that's buried in the jaw, something like that, then we wouldn't do that, mostly because that type of procedure would need some kind of sedation that we're unable to provide.
Now, I know that the Florida Department of Health has several clinics throughout Polk County. Can you tell us a couple of those, just so people, if they are interested in finding out more?
Sure. Yeah, we have 4 clinics. We have one in Bartow that's in the environmental building down by the administration building. We have a clinic in Haines City that's a standalone clinic. That's with the new building. We have a clinic in Lakeland. That's on Lakeland Hills Boulevard. And we have a clinic in Auburndale that's on Hobbs Road.
Now, are there any difference between the clinics as far as the kids that are brought in are concerned, or are they all just basically the same thing?
We've tried to standardize as much as we can. So the Haines City Clinic is a little larger because that's the newest one. So that one, sometimes we're able to get people in faster, but as far as the type of services and the equipment and things like that, all the offices are as standardized as we can get them. So you can pretty much go to any of the clinics and you're going to get the same care and get the same type of treatment.
Now, what are the qualifications that people have to be able to go to these clinics?
There are, if they qualify for Medicaid, and then with Medicaid, with the children, there's different insurance companies that handle the dental portion of Medicaid, and some of those same companies also handle adult Medicaid. We also we see patients through various grants. There's a low-income program. There is a...
That's with the county, isn't it?
Correct.
Yes.
There's a program with Polk Works. There's also a program if they're on Medicaid and they're pregnant. There's some additional funding for that.
Because actually, the Auburndale office recently took a tour of with the Indigent Healthcare Division. It's a beautiful office. Definitely, if you're in need of dental care, great place to go, beautiful office. Now, what ages do patients usually need to be at to see you for dental care?
I always say, just to make it simple, that we see patients age 1 to 100. And I know that's sort of a cute little way of saying it, but we want to see a patient no later than their first birthday, because we know they're going to have at least one tooth, and then up till they're still around. We see several nursing home patients, and so there's no really upper limit unless they need some specific medical condition that we can't handle. Then we would refer them elsewhere. But there's no upper age limit, and the lower age limit is whenever their first tooth comes in.
So basically, it's everyone in Polk County that's in need of these services. There is a place and a home for them to go to.
Yes.
Excellent. Now, how do people access these services?
The best way is we have a call center. The number is 863-413-2636 and extension 4, and that will put you to the call center, and that call center schedules appointments for all 4 clinics, and they also can handle any type of insurance issues or answer questions about your insurance if they're able to, or the various grants that are available, how to apply for those.
Well, Dr. Ebner, thank you so much for coming out today and telling us a little bit more about the different dental services that are offered in Polk County, and also a little bit more about National I Give Kids a Smile Month.
Thank you, Andy.
And remember that a healthy smile is always an important first step for any child to be able to really experience the most that they can get out of life. That's why February is National I Give Kids a Smile Month, which is aimed at providing free dental services to underserved children. If you'd like to find out more about dental service for children or for any special underserved population here in Polk County, go to the Florida Department of Health's Polk County's website at http://polk.floridahealth.gov/.